Hello, I'm Joanne Preston with the Rural Wisconsin Health Cooperative, and as a result of Flex Grant funding through the Wisconsin Office of Rural Health, we're bringing you this series of videos on the topic that's so important today and every day, the topic of communication. I had the great pleasure of being joined on this video series with a group of folks from Southwest Health in Platteville. Doctors, pharmacists, nurses, phlebotomists, housekeeping folks, EMT, administration, and so on. Folks just like you who are doing their best to try to create an excellent patient experience. And so they joined me to do some interviews and some role plays of some of the skills that we're working on in these videos. So I really want to put a shout out to them to thank them for participating and hope that you find that you can relate to some of their real life experiences working with some of these challenging communication situations. Today's topic really drills down on something we call keywords at key times. One of the things that we know is that there are specific times in the healthcare experience where what we say makes more difference than others. And it can really be powerful in gaining the patient's trust in us and gaining the family members' trust in us taking care of their loved one and having things turn out well. So what I want to talk with you about today is really going to focus on being a great communicator and knowing the times that it matters the most.
Greeting a patient at the door when you know that nobody's happy to come to a hospital when they've had many things go on in their outside life, and when they come in here, they need to feel comfortable as soon as they walk in the door, because those nerves and the fear is going to continue through their appointment if nobody is helping them along the way.
We have two learning objectives for today. Number one, identify specific situations where keywords can make a big difference in an interaction with a patient or coworker, and why saying the right thing at the right time matters. And number two, begin to identify how and where keywords fit into unique working situations and departments at your organization for the patient experience. So some of you may be wondering about keywords and if I'm going to be telling you exactly what you need to say and how to say it. So let me tell you what keywords are not. They are not a script. I am not a fan of scripts. I don't recommend that you read a script to a patient because it's going to sound like someone's reading a script. It's about knowing the words that matter, but saying them in your own way, in your own words, and from the heart, saying them genuinely. So keywords are not a script. They are also not a one-size-fits-all. Different situations require different responses. So some of your organizations may require or have a recommendation that you greet patients in the hallway. But how I greet a patient or how I greet you when you are happy, when you are smiling, versus how I greet a patient or someone when they are crying or obviously upset is different. So we have to be paying attention. That's really what's behind all of this, is being mindful of the interactions that we're having with people.
So managing up, if sometimes for me, I'll speak for myself, sometimes it feels inauthentic if I'm trying too hard to make sure I get it just right. Like this person does, the next person you're going to see does this, but if I just am really, you're going to go see Savannah now. Savannah is our phlebotomist, and she will take care of, your lab work. It doesn't have to be anything spectacular. A name, what that person's going to do for them, and just a positive rapport about that person is sometimes, I think, enough managing up to allow the patient or the person to feel like they know what's coming next. They know how to sort of address the next person. They know, like, this is a lab. I'm not a clinical person, so when I've had experiences in a hospital or in a setting like this, I'm completely out of my realm. I don't know who draws my blood. I don't know what phlebotomists do necessarily, right? So for someone to say, this person's name is Savannah, she is a phlebotomist, she's going to draw your blood, it connects the human, Savannah, with what she's going to do to help me. And that's so important. So I think the gist of managing up is just that connection, letting the patient know who is this person, what is their job, and how are they going to support me is really all it needs to be. It doesn't need to be a grand, reciting of their credentials or something, really in depth. It just needs to fill those blanks for patients because they don't know what we know here in the hospital, or they don't make those connections that we seem to make so easily because of our training.
Keywords are also not a way to force you to say something that you don't mean. It's really disingenuous for someone to say, do you have any questions? I have time, as I'm walking out the door. So you really want to have your whole body language and everything that is your eye contact all in line with what you're saying. So you can't be forced to say something that you don't mean, or it's going to come across not genuine to the patient, and that really backfires, just like scripting can. It's also keywords are also not a way to imply that you don't already know what to say. But in the truth, it is hard sometimes to know what to say, and habits are important.
I use a lot of phrases throughout my job, not just when somebody is perhaps upset. Thanks for sharing that with me. I really appreciate it. I'm sorry you're going through that. Let me see how I can help you. Do you have any further questions for me at this time? Is there something that I can make a little more clear for you? I think I find myself asking more questions to the patient so they feel that I'm really listening and that I really truly do want to help.
Our communication habits are important, and we want to always be ready with the right thing to say for patients, even if it's to say, I'm not really sure how to help you with that situation, but let me look into it. We don't have to have the answer, but we need to think about what we're going to say before we need to say it. It's not unlike going to a funeral or a visitation. As we're walking up to talk with a family who's lost a loved one, we're thinking about, how do I want to say this hard thing to say? And sometimes simple is best, but we want to think about it. So that's what today is about, is really think about what you want to say, because you're going to face some similar situations frequently because of the jobs that we do, and we see similar situations from time to time. I talked a little bit about what keywords are not, but I want to also give you a couple of tips about what keywords are. One of them is they are a consistent way to show empathy. Empathy is one of those things that draws us to healthcare. We care about people, we're empathetic, but keywords helps us to remember that when we get really busy and we get very task-oriented, it helps us to remember, oh yeah, this is really about the patient and really about their fear and what's going on with them. Keywords are also a way to create what we call a culture of always. So think about yourself. If you're going into a healthcare setting with your loved one, you don't want to go in and get average care and, or pretty good care and have people treat you okay. You want to go in and get excellent care and be treated in a way that's caring and full of empathy and compassion. Every patient, every time. So creating a culture of always, that's one of the things that keywords can do, because it reminds us, patients have told us these are times when it matters most, and we're going to talk specifically about what those times are. The best hospitals use keywords at key times because it's about creating those habits of excellence every day.
Right. I think the reason that I went into nursing is for the people. So I absolutely love and try to get to know everyone, get to know something about everyone that I can really help relate to them a little bit better. Whether it be something simple, but I really do try to leave that room knowing as much about the patient as I can, just general information to really help them feel comfortable. I also just try to make sure they're little things, checking in on them frequently to make sure they're comfortable, simple things like just getting them positioned, coming back and checking in. Some people are afraid, or they feel like maybe they're burdening you with asking for things. So I try to anticipate those needs rather than just, wait for them to put on their call light. So really try to anticipate what the patient wants, just to make them comfortable.
Keywords are also one of those ways that we remember that we each make an impact. almost to a person. My experience has been that most of us think that, we're not that important. My individual interaction with someone is not that important. But I will tell you that I go into hospitals all over the state, all over the country, and I walk through the building and I can really tell the difference when people are making eye contact with me, when they're saying hello, when they're making that connection, when I feel welcomed there. And I can tell that it's the culture that permeates, that every person recognizes that they matter. So when patients fill out their experience questionnaire, when they get surveyed after their hospital visit or their clinic visit, and they are asked, how did you feel that you were treated? The patients run into so many people when they walk through the doors. The minute they get out of their car in the parking lot, they run into so many different employees at your organization. And if 9 out of 10 people are great, but one person has a negative experience, it really shapes that patient's view of the organization. So every person matters more than you think, and these keywords can help you make that positive impact. We have learned from patients that there are 4 key times when communicating with keywords really matters to them. The first is delays. And everybody knows that it's really hard to wait, especially in healthcare. If you are a nurse and the patient's been waiting for you for an hour, you know that the patient's going to be frustrated. In the emergency department, waiting for the doctor to see you. If you deliver meals and the patient's hungry at noon, but the meal can't get there till 1 o'clock. Those are some examples of delays. Patients want to know what's going on.
I feel like I've been waiting forever to see the doctor. What's taking so long? I'm having a lot of pain and no one's been in here to see me for ever, it feels like.
I'm really sorry that no one's come to check on you. I know it's really frustrating when you don't feel well and you feel like you've been waiting forever. I'm gonna go check on things and I'll be right back in about 10 minutes, okay?
Okay.
You'll notice that in the video that the delay was explained in very specific terms. So it's really not helpful to say, I'll be back in a little bit, because to a patient, a little bit might be a minute where you're thinking a half hour. So I'll be back in 10 minutes. I'll be back in 30 minutes. People can wait if they know how long it's going to be. The second key time is communicating about your plans or explaining things. Here we're really talking about the willingness to narrate what you're doing, to narrate your care, to think out loud what you are doing, because to you it's every day, but to the patient it's never an everyday experience to be with you. So thinking about the things that you are doing with the patient and just talking out loud about that.
My name's Brandy, and I'm gonna be the nurse that's admitting you today, okay? Okay. I'm gonna grab the computer and we're gonna go through a few questions, all right? Okay. All right. Okay, can you first tell me your name and date of birth?
Julie Stevenson.
When it comes to explaining things, you'll notice that the nurse made eye contact with the patient and said, I'm going to get the computer and bring it over to you. So we do have to use the computer. That's just one example of a time when we need to explain things. But it's about making that connection with the patient first, and then do your work. People are much more understanding if you make that eye contact and that connection and tell them what you're going to do and why you're doing it. It's really helpful.
Even if it's a simple procedure, explaining everything, being very thorough, bringing them back, making them feel comfortable, establishing rapport. Immediately when I first meet the patient, introduce myself, ask them a little bit about them, get to know the person who's in the room with them, because they may be just as uncomfortable as the patient. So really getting to know them on a different level and showing that I care beyond just the procedure we're doing, but care about them and what's going on in their life. I think in my role, being as thorough as possible and in explaining when I'm doing things, whether it be starting an IV, talking them through the process, sidetracking them if they kind of want, they don't want all of the information, just really trying to establish that rapport and also being thorough and explaining everything that I'm doing with the patient.
Dealing with sensitive issues, problems, or changes. Here, we're thinking about all of the times, put yourself in the patient's point of view, and when we are in a healthcare setting, we are so vulnerable. So we're asking people sensitive information. We're asking people to disrobe and wear those little gowns and feel exposed and uncomfortable. We're explaining things that are going to change. Maybe the patient expected to have a treatment that day, and because of some reason they cannot have it. So we need to explain all of these things that we know about, but the patient doesn't always know. So it's helping to put them at ease by calming their fears.
Hey Ashley, thanks for coming in today. I appreciate it. My name is Julie. I'm going to ask you a few questions about your financial information. I want to just reassure you it will remain confidential with us. They do feel a little bit uncomfortable, but please know that we want to get all the information that we can so that we can make sure that when you leave here today you're happy and feeling like you're taken care of.
When you're asking a patient for sensitive information, remember that it's your job to ease their fears. So your tone of voice, making eye contact, what you're really doing is making it safe for them to share with you. Turning points are another opportunity for keywords. So think about your work and the times when you need to move someone through something, a process. I often think of the experience of being on a gurney. Imagine yourself on a gurney being wheeled through a hospital, and what are you seeing? You're seeing the ceiling tiles, but the person that's walking you knows where they're going. So just even saying to the patient, I'm going to be taking you to surgery. We're going to be going down the hall here, and then I'm going to make a left turn. Now, how important is that? What's important about that is that it builds trust. So you always have that opportunity to build trust. Turning points also include managing up your coworkers. I'm going to be handing you over to Roy, and he's going to be taking care of you after I leave my shift today. Roy has a lot of experience in this area, and you're going to be in great hands. That's a turning point as well.
Today.
Good, how are you?
Good. It looks like you're looking for something. How can I help you today?
Yeah, where's your pharmacy at?
Oh, absolutely. We're on the wrong side of the building. Our ER is on this side, but we're going to go this way, and I'll show you. Actually, our pharmacy just relocated, so I'll show you where that's at.
Think of turning points as your opportunity to build trust with patients and families, whether it's someone who's lost in the hallway or whether you're turning your patient to another caregiver that's going to be taking care of them the next shift. It's an opportunity to build trust or lose trust at every interaction. So turning points are those moments of opportunity for you to really build trust from your patient.
I typically kind of just go with the flow. I mean, most of the time I'll say, okay, are you all done for the day? Do you need to go somewhere else? And then I'll say, do you know where that is? Should I walk with you? I always offer, most of our patients do know, so I always offer to walk with them or give somebody a call and say, hey, so-and-so is on their way. So I think they feel comfortable that way.
As we bring this session of keywords at key times to a close, I want you to do 3 things. I want you to look at the handout that you have with the exercises in it. It has an opportunity for you to think about what are your key times that you can use keywords in your unique work area. For everyone it's different. For nursing it's different than housekeeping, than maintenance, than pharmacy, than in providers. It's all different depending on what your work area is. So take a moment and fill out that worksheet so that you can start to prepare your keywords for ones that you need to have ready. Second, I would love for you to talk with your team and talk about what are the opportunities that we collectively have for keywords so that our patients and family members are hearing consistent messages from each of us. The third piece is, as you look at all of that together, pick one thing that you're going to try to implement very soon so that you can really ingrain this practice into your regular habits. Because at the end of the day, it's really all about communication. Thank you.